Most veterans walk into their C&P exam completely unprepared. Nobody explains the process, and nobody tells you what to expect, and that can cost you. In this video, I want to walk you through the actual C&P exam process, from how to prepare all the way through the exam itself, and some of the mistakes I see veterans make over and over again. This is not legal advice. I'm not a lawyer. I'm not a VSO. This is information, what I want to get out to my fellow veterans, to better prepare and educate everyone on the claims process. This is the stuff that I wish somebody would have explained to me in plain English from day one. If you're new here, welcome. Been here before, welcome back. On this channel, we talk about VA disability claims, veteran resources, and various tips and advice to help the veteran community. And today, we're talking about C&P exams. For some veterans, they can be one of the most stressful parts of the whole VA claims process. So, what is a C&P exam? C&P stands for compensation and pension. This is one of the ways that the VA gathers information when evaluating your claim. In many cases, the VA contracts out these exams to third-party providers. These providers do not work directly with the VA, but they do have access to the systems and information needed to complete the exam. But what triggers a C&P exam? Typically, C&P exams are ordered when you file a new claim, or when you request an increase in an existing claim. One important thing to remember: when you initiate a claim or request an increase, the VA rater may look at your claim and determine there's already enough evidence. In that case, a C&P exam may not even be needed. This can happen when there is strong evidence that your claim or condition is a direct result of your service. For example, something like the loss of a limb may not require the same level of additional review. On the other hand, the rater may look at your file, see other related conditions, and decide that a C&P exam is needed to evaluate those additional conditions. This can especially happen if you are filing a condition as a secondary to another service-connected condition. In many cases, if a condition is rated as static or permanent, it is less likely to be re-examined. But that doesn't mean it can never happen. Also, veterans over 55 are generally less likely to be scheduled for routine exams. But again, this is not an absolute guarantee. The main thing to remember is, anytime you file a new claim or request an increase, it can potentially open up your claims file for review. Also, you may have separate C&P exams for different types of conditions. For example, if you file multiple claims, one for, say, mental health condition and, say, another for a physical injury, you may be scheduled for more than one exam. Those exams may be with different examiners, and sometimes even at different locations. The examiner will usually stay in their lane, meaning the physical examiner is usually not evaluating mental health conditions, and mental health examiners are usually not evaluating your knee or your back. Now, this is important. The examiner is not there to diagnose or treat you. A lot of veterans walk into these exams thinking it's like a normal doctor's appointment. It's not. The examiner is there to gather information. They're there to help determine if your condition is related to your service. And also they're there to answer specific questions that the VA may have. Some of the things they're looking for are like, do you actually have the condition? How is it connected to your military service? How severe is the condition? And how does your condition affect your daily life? The answers to these questions, along with a physical exam, if one is needed, can carry a lot of weight for your claim. Let's talk about what you should do before the exam. Preparation is key. A lot of veterans accidentally hurt their own claim by walking in unprepared. First, you need to make sure exactly which condition this exam is reviewing. Go online and look up the DBQ for your specific condition. The DBQ is a disability benefits questionnaire, and this form is very valuable because it gives you a clear picture of what exactly the examiner is looking for. Now don't worry, you don't have to memorize everything from this form. I've even heard that some veterans will take notes based on this DBQ and bring it to their exam. It helps them stay on track during the exam. I've never personally done it, but I don't think it hurts anything, especially if you have issues with your memory. The main point is, you need to be prepared to explain your condition clearly. Another thing I recommend is reviewing your medical records before the exam. Log into your VA portal and download your blue button report. If you have a C file, that can help too. If you're using a private doctor, review those records, especially if you're submitting them as evidence in the claim. Knowing what's in those records is valuable. Some of the main items you want to know from your records are: what's documented about your condition? Has it been given a formal diagnosis? Are there any concerns or complaints noted in your records? What treatments have you had for the condition? Sometimes the examiner may have your records in front of them, and they may ask questions based on what they see. Having this information fresh in your mind can be very helpful. If you're asked a question and completely draw a blank, it can create doubt or confusion to the examiner. Now, also, you don't need to overwhelm yourself with preparation. Focus on the condition that's being evaluated. Stick to the facts. So now let's look what happens during the exam. First, try to remain relaxed. I know it can be difficult, but just remember, you've been through far worse. This is nothing like MEPS, right? Now, the biggest advice I can give is be honest. Don't downplay your symptoms. Also, don't turn the exam into a conversation about every single medical issue you've ever had. Stay focused on the condition that they're evaluating you for. The examiner only has so much time with you, so you need to use that time wisely. Answer what you are asked. Provide the facts. Stay focused. Again, know how your symptoms affect your everyday life. But also don't minimize your condition. A lot of veterans have spent many years minimizing pain and symptoms. It's because that's how we were trained. We were trained to just push through it, suck it up, soldier on. But the VA examiner cannot read your mind or feel your pain. If migraines make you lay down in a dark room twice a week, say that. If your condition causes you to isolate yourself from others, say that. If your knees hurt after standing for 15 minutes, say it. The exam is about your condition and how it affects your real life. But also try not to generalize too much. If an examiner asks how many times per week you get migraines, instead of saying something like, 2 to 4 times, try to give the most accurate representation you can. For example, if it happens around 3 times a week, say 3 times a week. Another big one is the pain scale. The examiner may ask, what's your pain level on a scale between 1 and 10? You need to be accurate here. During the exam, this may be one of your better days, but again, don't downplay it and make that clear. You might say, well, my pain is around level 3, but this isn't typical. Most days it's closer to a 5. Again, this is about your everyday life, not just a brief encounter with this examiner. On the other hand, I've even heard some veterans say that their pain is a 9 or a 10. Well, let's put that into perspective. On a 1 to 10 scale, a 10 is usually the worst pain you have ever endured. If you're truly a 9 or a 10, there's a really good chance that you would be in the hospital right now, or at the very least unable to function normally. And if you walked into the exam without assistance, then that can be a red flag to the examiner. Be accurate, but most of all, don't exaggerate. Never make things up. If you claim something that is not true, it can permanently damage your credibility. We're not here to game the system. We're here to explain what is actually going on with us. Now let's look at the exam itself. Some exams can be as little as 15 minutes, while some can be over an hour. Some are in person, while others may be virtual. Every examiner is different. Some can be easygoing, while others may be very clinical. I've had some examiners that barely talk, but don't let that throw you off. Quiet examiner does not automatically mean you had a bad exam. Again, just focus on your symptoms, their frequency, their severity, and most importantly, how they impact your day-to-day life. For physical condition exams, such as your back or your neck or your knees, the examiner will probably check your range of motion. The key here is don't force the movement past where the pain starts. This is very important. If they ask you to bend over or raise your arm or bend your knee or even move your neck, stop when the pain begins. A lot of veterans tend to push through their pain instinctively. Why? Because that's what we did during our military lives. But in this exam, this is where you need to show how the condition actually affects you. The exam is supposed to measure your functional limitations. It's not a test of how much pain you can tolerate by pushing through. Now for mental health exams, these can be tough. Having to talk about personal things to someone you don't know can be very challenging. But you need to be open and direct. Most mental health examiners are trained in this field, so they're usually sensitive to the conditions that you're facing. That being said, I'm sure there are some out there that are not as good as others. You just need to remain focused and answer the questions as best you can. The key thing is this: when you answer your questions, focus on your worst days, not your best days. Most veterans default to, well, yeah, I'm dealing with it, or everything's okay, or even, hey, I'm okay. The examiner needs to understand the actual level of impairment you're experiencing. Things like, are you having sleep issues? Are you isolating yourself? Are you having panic attacks? Are you dealing with anger? Are you having memory issues? Are you having difficulty at work? Are you having relationship issues? All of these things matter. So what happens after the exam is over? Well, first, you won't get your results immediately. The examiner needs to complete their report and submit it to the VA. A VA rater is then assigned to your case and reviews everything on your claim. This consists of your service records, your medical evidence, buddy letters, personal statements, outside medical opinions, and of course, the DBQ and exam notes. Once that view is completed, you will eventually get a decision on your claim. Now, sometimes you walk out feeling terrible about the exam, and yet you still get a good rating. And sometimes you think the exam just went great, only to find out it did not go your way. Whatever the result, just know that you did your best, and you were honest and accurate to the best of your ability. If I had to summarize this whole video into a few points, it would be these. Be prepared. Be honest. Don't minimize your symptoms. And don't exaggerate. Stay focused and on task. And remember, this exam is about the day-to-day impact your condition has on you. It's not about whether you can tough it out for 15 minutes in an exam room. I hope that this video has helped you better understand the C&P exam process. And if it did, hit that like button, as it does really help this channel get information out to the veterans. If you're going through the VA claims process, consider subscribing. The whole focus on this channel is to help our fellow vets navigate the VA system. And if you've had a C&P exam before, drop your experience down below in the comments. You never know, it may help another veteran walking into their first exam. And as always, I appreciate you guys watching, and we'll see you on the next one.